So always assess a person when they're standing, because it changes once they lay down. You got an anterior head carriage. The outside of his ear should be back here. Okay, and it's forward. Okay? Now what happens when you do this? This follows. So what's happened is that both of your shoulders are slumped this way. And you're saying you're a gamer and you play a lot?
Yeah.
Okay, so when you're like this, going pew 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 all day long, okay, here's the muscles like this. Let's pretend they're attached here and here, okay? And now you're going to slump your shoulders. They become stretched out, okay? When you retract them, they go back. When you protract them, they go this way. The shoulder tends to come out of socket this way slightly, and it stretches the anterior muscles. Here's the front part of his humerus right here. And see how I'm pushing on it and it comes back? See that? Here's him slouched. See how that pulls the humerus back into socket? Out of socket. Not out of socket, but strained in socket. No strain, no stress. And so we've got a problem right here in the mid-back. And so yeah, you're going to have a little bit of aching in your mid-back because the muscles are being held at tension versus relaxed. The back muscles, if you asked your bicep to do that, how long do you think it would give out before it would? Not very long, right?
Because I don't work out, it won't take very long.
Okay, I'm just saying, like, I'm trying to give you an analogy here. Your back muscles hold you up all day long, and they never complain. You know, is it easier to carry a weight here or out here? Here, okay? So as the more you go forward, the harder those muscles have to work, and eventually they feel it and you feel pain. Just like march in place. Yeah, step, step, steps. We have something in your mid-back. So pelvis is shifted to the right, classic 80% of the population. But there's something here I haven't quite found out that is bringing the shoulder higher. Okay, do you feel more restriction when I go here versus here? I mean, look at that. Look at how loose that is. I'm not sure if you can tell that. Versus that. Can you feel that?
Yeah.
You feel like this is like a little bit more, like something stuck in
More
there.
tense.
But very little scar tissue in your neck. What we would call trigger points. All right, you ready for the adjustment? Because there's not much to work on here. But I still have to take this tension off of here. Or it doesn't matter what I do here. If I don't get this right,
Well, do what you gotta
it
do.
just pulls it right back out again. You know what I mean? The whole thing. You got to get the eyes level with the horizon.
Just go for it.
Just get it?
Yeah.
All right, here we go. It shouldn't feel like anything. It does make a sound. Right here. Ooh. There it goes. Very good. Other way. Ooh, it already kind of went. And there's the other side.
That's cool.
Okay. Not what you thought?
I expected pain.
There's no reason for it to be painful. It could be painful for a couple of reasons. I don't have any reason to believe that it would have been painful for him. That's why I do this kind of stuff right here. Mm-hmm. I'm literally scooping his atlas and rocking it under his skull. When you take the pressure off of the joint before you adjust it, like I'm doing the final set, like a set and hold here. If you do that before the adjustment, it doesn't feel as jarring. So it should feel good. Okay, I'm gonna go to the feet, okay? And is it in here that you feel the numbness?
No.
In between the toes? No. So it's right on the toe?
Yeah.
And have it up into here as well?
To that joint, I
To
believe.
this joint, but does it go like beyond?
No.
Into the tip of the toe? Nothing broken?
No.
Oh, it's pretty stuck. Does that hurt?
Nope.
You are capable of cracking. I'm just trying to see what we got here. Okay, this big toe doesn't move either. Oh. That was 3 joints in one. That was like... And this toe, you've already moved. 2, 3. 1. But this one... Okay. It is swollen. Does that hurt when I'm pushing on it like this?
Not at all.
Can you crack it?
Try.
Crack
I
your
usually
first.
pop them like this. But now it won't pop.
Okay. You do that a lot?
Yeah.
Okay, be careful because the way you're doing it is you're pulling it to the side I can hear grinding in there when you do that. How often do you do that?
Every once in a while. Sometimes it'll just pop like this.
Okay, there are little nerves, like little spaghetti strings that come in here. When you pop it, you might be damaging it. So be careful. Be careful with it. If you want to pop it, go just one way, like that way.
Okay.
Don't take it to the side.
Okay.
Okay, then we get tight right here. Good. Yep, again. And out. All right, that's all that's gonna go. Ooh, did go. All right, now I'm gonna do the green roller. Are you ticklish?
No, it just feels tense.
You're fine here. You're fine here. Fine there. This is where I start to have a problem, right there. That's from sitting. If I were, you want to take the shirt off? You don't mind?
Yeah, no, I don't mind.
Get up and move. Watch, this side is already bruising. So everything compensates. This is where it starts. Sorry, this is not very pleasant. It starts right here on this side. And goes all the way down to about there. And then it switches to here. He's more prominent on this side. This side's going to have the petechiae and more swelling. Hardly anything has come out here. Okay, that's congestion over here. So every time I push on this, it's going to get worse. It's fine. It needs to come out of there. You need to keep it clean. You don't want that sitting in there. Usually the side of the curvature, the lateral curvature, more petechiae will come out every time. Now, he's got one faint one right here coming out. And my bet is that this is the one rib. There's always one or two ribs on the opposite side of the lateral curvature that break the pressure, that take the tension off of it. And that's this one right here. Almost everyone has this. It's okay. But you got to keep it cleaned out. You don't have to buy an expensive one like this. People always ask, where do you buy this? And they look it up on Amazon. It's $150. I'm like, you don't have to buy the $150 one. I have to buy the $150 one, okay? This one's heavy duty. This, I can put all of my pressure on him and it won't break. And there's some guys where I need that kind of pressure. This is his first time, so I'm not going to be too violent, too aggressive.
Destroy me.
Oh. Woo! Yeah. Oh, he's got a nice one right there. Okay, before I make him too much more purple with this thing, I'm gonna use my elbow. On this one, it's all the way up at the top. Okay, and I'm not on the spine. People think I'm on the spine. I'm not on the spine. I'm right on the lateral wing, the transverse process, where the rib head meets. Right there.
Should I get closer?
When you feel along somebody's spine and you feel these bumpity bumps, those are the spinous processes. That is very painful. You're not on the spinous processes. I'm just lateral to it, right here. If I were to go here, I mean, see that? That's very painful. I don't expect anyone to learn this in one day. You learn to feel those things. You're not going to learn unless you keep doing it. From day one in chiropractic class, you learn how to feel. From day one, you're in there palpating each other's spines. It's like day one of care class. Yeah. Where's the spinous process? And you count. You learn to count and learn how to feel. We call it HVLA, which is high velocity, low amplitude. High velocity, speed, low amplitude. So not, the depth isn't very much. It's more about speed than it is force. But even so, I don't want to go to an area that's already hyper mobile. It moves too much. Why would I want to go to an area very prone to herniate and do an HVLA adjustment, bam, to that segment? Why would I do that? No. Pass. He's taken a beating his whole life here, which I can tell because there's multiple knots here. Let me get started. It's just one scar upon another. You know, this area, when this stops moving and gets knotted up, which it very frequently does, the force then goes even more so to the lower back again and the lower neck. Okay? If I can smooth this out, if I can drain this region, get this part moving as much as it's possible, as much as it's capable of, it will take the pressure and the workload off of the lower neck and the lower back. You have to work up to it. You saw first I did what? I was using the palm of my hand. Then I worked up to my elbow. First we did the green roller, and that's really kind of mild. I know it looks brutal, but it's more mild. Now this is not mild. This is no joke. That's no joke right there. That's very good. You have a high pain tolerance. It's okay, breathe. Take some breaths. 2, 1 more. Ooh, there we go. As long as I can cut through it and it rolls, we're good. And I'm gonna go here. Infraspinatus is usually a nice little nerve bundle right here. Scrape that through. It's just the thumb is like nice and thin and can get through those muscles more specifically. Whereas this is just a broad, non-specific motion here. You okay?
Yeah.
But you can even see the petechia coming out. He has like a little stretch mark here from when he grew. And you can see it already coming through. I'm trying to bring that to the surface so that this can get dissolved over the course of a few days. Anytime you have soft tissue work, crap comes out and gets circulated into your bloodstream, and you can feel ill afterwards if you don't drink enough water to flush it out. All right, iliac crest. This is for the QL muscle, quadratus lumborum. Go up into here, see that contracts, good. That's what I want. Pull the spine over. Yeah, come on. No, actually, come up here. All right, so he had a curvature here that was compensating for this one. It's now starting to. When I go like this, that pulls it, and that will pull the spine over. That's what I want. Like that, right there, and there it goes. So that's what I'm looking for. Okay. Woo! You did it. I don't have to go as hard on this side. But whatever you do to one side, make sure you do it to the other side. The other side will pout. It doesn't like that. So here's the top of his iliac crest right here. Top of his pelvis. Okay? I'm going right along here. You gotta go to school for this stuff. Here's the SI joint. Here's the sacrum right here. Here's the SI joint right here. It's like a ridge. Okay? I don't adjust here, but you will see me get some motion here. You falling asleep yet?
Close.
I thought he was asleep for a second.
Yeah, here's that compensation. Woo! And there it is. And watch, I'm not going to get much over here, I can already tell. It's just along the spine. But it's not too bad. Now it looks red. This is just because he's fair. He's really pale. And he needs a tan. He needs to get some vitamin D. All right. I look like this. I just get bright red. This goes away. What stays is the petechiae. Oh, I rhymed. Yeah, I'm going to put some arnica on it. And arnica really constricts the blood vessels, and that will just help this whole process quicker. If I don't put the arnica on, it takes 4 days to a week. With the arnica, it takes like 2 to 3 days. I didn't believe it, but my naturopath doctors were like, Dr. Brenda, there's a thing called arnica. And I'm like, yeah. And I started like slapping it on people. I was like, oh my God, it works. All right, fine. You know, if it works, it works. Now, what I still haven't gotten was this little one right here that we felt when he was on his back. And I didn't work on your shoulder either. Time to get him up. All right. You're going to have to wake from your slumber. Sorry. Come on up. Let's try the bad side. Oh, you can see it. Can you see it right here? Anyway, here we go. All right, he's tall, so I feel like really vertically challenged here, working on him. Look down and away. You elongate the muscle, and get a little bit more depth. There it is. Does that hurt a little bit?
No.
Yeah, that's nasty. A little sore. That's swollen. Go up into the neck, head down. I'll stretch the muscle out. See if there's anything in here. That just turned like, you feel the heat coming up. But that's healing, okay? You want to promote blood flow. You want to promote healing, right? Fresh blood brings in oxygenation, clean out those dead cells that are always proliferating. Your body does it naturally. This is just accelerating it. Again, the muscle is the trapezius muscle. It comes down here and then it attaches to the acromion process here. So I'm going in the plane of this muscle. Erector spinae go this way. Trapezius goes this way. Supraspinatus goes this way, a slightly different angle this way. So you can get in the supraspinatus. I angle my instrument this way and go along the plane of the supraspinatus. So it's a slight differentiation between this and that.
Mm-hmm.
Here's the spine of the scapula, goes slightly south. Infraspinatus goes this way. There's the trapezius, and underneath that is the rhomboid. So it just depends on which muscle group your focus is.
Mm-hmm.
So what I want you to do is have your arms with your thumbs down like this out in front of you. We call this empty can. Okay, now push up. Any pain when I do that? No, and then thumbs up like this. Push up. Any pain?
No.
Right, bend your elbows like this. Push up. Any pain? Up like that. Nah, I think you're okay. Okay, so the long head of the bicep. Pull. Okay, not too much. I'm not as strong as you. But right here, okay, there's your bicep. It goes up into here. And here's the bicipital groove right here. Now, where you test this out. Now push against my hand. Oh, there it is. There. Any pain here when I do that?
No.
Okay, I can feel it rolling in there. But it's not out. It's very painful when it's out, so I'm testing it. But it goes all the way up into over here, the long head. Okay, so when somebody says it hurts all in here, my bet is on the bicep. Doesn't necessarily mean it is, but if I had to place a bet, that's what it would be. The short head goes up into the coracoid process right here. It's a bicep, two muscle groups here. The one goes all the way, and that's the one everybody tears. They very rarely tear the short head. So I'm feeling it. It's in this groove. I can feel it rolling around. There's a retinaculum that keeps the biceps tendon glued to the humerus. When that gets torn, people can have this symptom, but his is intact. So you must have just really irritated it playing volleyball. Nothing's torn. Everything is intact, and it just got irritated and it swelled. I don't feel anything wrong with your shoulder. Go ahead and take it up this way. No pain this way.
Nope.
How about across this way? Bend your elbow. You can see it's not out of socket. That's called dugus. So he's just, I think if anything, it was from poor posture. The humeral head is sitting mildly out of socket, putting strain on the front of the bicep tendon, causing irritation every time you punted it, the right
Spike.
spike. Sorry. I don't know. Every time you spiked the ball. Nah, I don't feel a thing. I have a theory. Jeez. Force equals MA. We're gonna see if little Dr. Brenda can do this. There it is. Very good. You're like, I can't believe I'm letting this woman do this. Other side, face the other way. Does it feel like you're being violated?
No.
No. Head back for me. Head back. That's it. Oh, I think it already just went. There's the rest of it. Okay. Very good. I'm going to teach you how to do the foam roller. Do you want your ears adjusted?
What is that? Just do it. Do whatever you want.
At this point, you're like, I need a nap. Yep, not ear to your shoulder. There it is. Lean away. More and more. Pull. Open up the eustachian tube. Crack. Good. Good. Ask your mom if you ever had an earache on this side.
I will.
Yeah, it kind of seems, which is rare because most people have earaches on the right-hand side.
Sorry.
No, it's okay. Go ahead. Get on the one.
You can edit those into other clips.
No!
Can't get that one.
You know, different joints have different sounds. The fingers are like a lighter
Other
sound.
chiropractors are gonna call you out.
Oh yeah, they'll take it and tear it apart. No, none of the cracks are edited. That's just the way it is. All right, so we're going to get the film roller. I'm going to lay you on it. We're gonna cut this video right here.